And new tonight here at 10. Surprise expensive medical bills may just soon be a thing of the past. Starting January 1st, the No Surprises Act will establish new federal protections that proponents say will actually save Americans millions. But how will it work? And who exactly will it protect? 12 News reporter Simona Barca joins us live to break down what this means for patients going into the new year. Simona.
Letitia, until now, only a fraction of insured Texans had protection against surprise costs. This new law will expand that to cover more insurance plans, which will cover millions more people. New year, no more surprises.
Nobody wants to get a surprise bill.
Currently, 1 in 6 patients who seek emergency care or have a surgery receive a surprise bill. These bills arise when insured consumers unknowingly receive care from out-of-network hospitals, doctors, or other providers they did not choose. Now, these services will be charged as in-network.
The biggest changes is emergency department visits, actually. It requires that whether you visit an emergency department that's in-network or out-of-network, that you only be charged the amount that you would expect to pay from an in-network emergency department. That includes the actual facility and any doctors, any lab work, any diagnostic imaging you have.
Exceptional Healthcare Chief Operating Officer Bruce McVeigh says the new law takes the patient out of the equation in a good way.
We'll sort that out with their insurance company later. And that's really the plus of this bill. It takes that stigma off the table. It takes that confusion off the table. And now every constituent and patient out there should not have to worry.
People who've experienced these surprise bills say the new change will be a blessing.
For elderly people, especially people who are on disability, when you go to the emergency room, you want to know up front what you have because your funds are limited.
Advocates say the new law will save patients millions, but will these savings change the industry?
It's ultimately going to trickle down to our premiums, our co-pays, our co-insurance, things like that. So it's a step forward temporarily. I still think we have a lot of work to do.
Chris encourages people to become very familiar with their insurance coverage and what services are included. And if you don't completely understand it, reach out to a health advocate. We have a few links on our website to help connect you. I'm live in Beaumont. Simona Barca, 12 News.
All right, thanks, Simona. Well, also taking effect on January 1st, 23 new laws here in Texas. And one of those laws will require Texas landlords to notify renters of a flood risk. Now, this is huge news for families in Southeast Texas, considering the sheer amount of natural disasters that we experience. And some of the others include new rules on property taxes, tax credits, and regulations on restaurants and food delivery services. You can visit our website, 12newsnow.com, for the complete list.